Hello lovelies, this is Inge Fleur, your fertility homeopath, and I'm back with one of my quick question videos, and this one is about how due dates are calculated. I got an interesting question on my video I did recently on whether you can use ovulation tests instead of pregnancy tests. If you haven't seen it, go check it out. I'll make sure to link it in. And the comment was as follows. This lovely says, I have a question about how due dates are calculated. They don't make sense to me. If I ovulated on November 30th, it tells me, assuming I get pregnant this cycle, that I'm already 2 weeks and 5 days pregnant when I only ovulated 4 to 5 days ago. Why is it calculated this way, and how do I make sense of it? Thanks so much. Well, the easy answer is because due dates aren't actually usually calculated from the day we ovulated. Go figure, right? But this has to do with the fact that most women don't actually chart, so they don't know when they ovulated. And even before charting was a thing, they also needed something to calculate the estimated due date. And what they use for this, your OBGYN, general practitioner, even your midwife, is the first day of your last period. Because it is assumed that we all ovulate around cycle day 14, which isn't the case, obviously, but they need to use some sort of standard. They use that first day of your last period because you can't get around that. So gestation, which is pregnancy, is usually around 38 weeks. That is the average. So if you want to use the first day of your last period, they add 14 days, 2 weeks, so that's 40 weeks. That may ring a bell, right? We usually hear that pregnancy is 40 weeks. Not actually true. So when you do know when you ovulated, you add 38 weeks. The thing is that the pregnancy is still considered to have started on the first day of your last period. So it starts with the beginning of your cycle. And that is why it says you have been pregnant for 2 weeks and 4 or 5 days, which isn't actually the case. Or maybe it is the case on a very philosophical level because that is the cycle you got pregnant. So maybe you were already pregnant. Okay, let's not go into this, shall we? Now, being able to estimate your due date properly is pretty important because if you, for example, ovulated a week later than the standard day 14, then your doctor may start to talk about inducing you before your baby is actually at term. So it is very valuable to have information on when you ovulated. So if you're charting and you have your charts, make sure to give them to your practitioner or midwife so that that due date can also be pushed back. The good news is this is even possible if you have irregular cycles. It is a bigger problem, the estimation of your due date, if you have irregular cycles with the first day of your last period. If you have cycles of 50 days and sometimes of 14, it is pretty tricky. But if you are charting and you can pinpoint when you ovulated, then your estimated due date is so much more accurate. If you're having trouble finding your fertile window because you have irregular cycles, because, for example, you have PCOS, go check out the video on having PCOS and finding your fertile window because the information applies to everyone that has irregular cycles. I will link that in right now, so it should be on your screen so you can head on over there if this is of interest to you. In the meantime, see you in the next video.